Welcome back. While the COVID-19 vaccination process is underway in New Mexico, the long-term health and economic impacts from the pandemic on the state's Native American population will be felt for a while. In response to that, Bank of America is directing over $13 million to Native American communities all across the U.S. who are disproportionately impacted by the coronavirus. Now, I spoke with New Mexico Market President Paul Mondragon to find out more about how the Bank of America is helping support Native American communities. Paul Mondragon is joining us this morning. He is the New Mexico Market President with Bank of America. Paul, great to have you with us.
Thank you. Glad to be here.
Definitely. Right now, let's delve into this here. You know, the support that has been given to the Native American communities now. Let's talk about the partnership and the collaboration that with Bank of America, what's been able to do to help them here.
Sure. Yeah. So with this global pandemic that came around last year, we understand that communities of color are most at risk, given systemic issues that have plagued these communities for generations, really. We know that these sometimes poorer populations are affected by health care risks to a greater extent. And so Bank of America is seeing that both especially in Native communities here in New Mexico, but across the country in any community of color, we're working to support those folks.
Yeah. And right now, it wasn't even just a matter of monetary support. It was also in the form of PPE, correct?
That's correct. Because it's a health pandemic, there are other ways that we could help. So here in New Mexico, we've given over 40,000 masks, 38 cases of hand sanitizer, and 25,000 pairs of gloves to the Native communities. We've given more beyond that to all communities here in New Mexico, but that's specifically to our Native American communities.
Let's talk about the importance of why that distinction was made and how it's going to continue from here.
Sure. Well, of course, everybody needs help at this time, and we have given help broadly, to hospitals. But again, going back to the systemic issues and the history of these folks not having the overall support that other people might have had, that they may not have had the opportunities, whether it's on the health side, hunger, housing, and economic mobility, jobs. We see that strikes communities of color at a greater level, and so we want to help out. I think here in New Mexico, I read last week that 42% of our COVID cases were with Native Americans. And when Native Americans, I believe it's somewhere between 11 and 13% of the overall population. That's just way too much. And we're seeing that across the country, that Native Americans, our Black communities, Hispanic communities are being hit the hardest.
Exactly. So for anybody watching now in either in the rural areas or in the Native American communities, if they want to find out more about the opportunities and some of the help that's available to them through and from Bank of America, how can they find out more?
Sure. So we have donated through a number of entities. So Roadrunner Food Bank, the First Nations Community Health Source, and the Indian Pueblo Cultural Center's Pueblo Relief Fund. I'll get it all out there. That is where, so for instance, that is where our PPE donations went through, was the Indian Pueblo Cultural Center's Relief Fund. And so they could work directly with them. We are shipping in bulk, so if it's a single small community, we probably wouldn't go that direction. But please reach out to the Indian Pueblo Cultural Center, and we would be more than happy to put together another package, which then they would distribute to the 19 pueblos of New Mexico.
Awesome. Paul Mondragon, thank you again for joining us this morning. We appreciate it.
Thank you very much.